Okay, Mark, thanks very much for that. Meantime, the rate of coronavirus tests coming back positive in Maryland continues to rise.
But there are two different numbers for the state, one from the health department and the other from Johns Hopkins. WMAR 2 News' Aaron McPherson joining us live outside of Johns Hopkins in East Baltimore. Aaron, talk about the difference in these numbers and what this means for the state.
Well, right now, the Department of Health is reporting a less than 4% positivity rate, and Johns Hopkins is saying that it's above 5% for 3 days straight. And doctors here at Johns Hopkins are concerned that if this trend continues, it's something the state might have to consider for scaling back on that reopening process. Now, starting today, Baltimore City moved into stage 2 of the Roadmap to Recovery plan, now matching Anne Arundel County, while the rest of our viewing area is in stage 3. Now, the critical care physician who runs the ICU at Johns Hopkins says the difference in their numbers and the Department of Health comes down to the number of people versus the number of tests. Hopkins bases their number off of the amount of people tested, while the state uses the total number of tests conducted.
If a person went to the hospital and was tested 10 times over 10 days, meaning once a day, then that person gets counted as once. Where for the state, if that person went into the hospital and gets tested every day, all of those days, those tests count for that person.
He says regardless of the difference, both show an increase. And he says we also have to consider those other metrics like hospitalizations and number of ICU beds, which according to the state, those numbers are up from the weekend. But the takeaway here is that we are still in the middle of a global pandemic. So even though things are reopening, we still have to practice social distancing, wear our masks, and of course, continue to practice good hand hygiene. Reporting live from Johns Hopkins Hospital, Aaron McPherson, WMAR 2 News.